thank you all for joining us for this episode of the High Desert Podcast. We're here as always. Well, maybe not as always. Maybe we'll film on location at some point.
I don't know if people really notice that the way you say High Desert Podcast is like podcast. Yeah.
Well,
so
I think I say pod like I don't say pod. It's just so they get the hint. High Desert Podcast with a PAW. Oddcast. Podcast.
It's odd. Oh, no, it's pod.
It's an odd, yeah, it's not odd, so anyway. It's pod.
Welcome, everyone.
Well, thank you for joining us again from snowy, cold, but beautiful Santa Fe, New Mexico. Today's guest is Dr. Jennifer Steketee. She is the Director of Veterinary Services. I'm getting that right? I'm always forgetting.
Sure.
Okay.
No. Dr. Steketee, why don't you tell us your proper title?
Yes, please.
Proper title, Medical Director.
Medical Director. That was close.
What does that entail, anyway?
Basically oversee the medical departments for the shelter, mainly our shelter animal clinics, overseeing the health of the shelter animals.
Right. Go ahead. Rob, do you have...
I do. We're going to go straight into questions here, and I put them on a digital device because I'm known for rustling paper too much. So the first question we have, so I got some questions from our, a social media community. And without a doubt, the most common question was about food. I think mainly because that relates to cost of having a pet. So in terms of grain-free versus some of the lower-end bulk food products, is there a difference? Or is there things that pet guardians or owners need to be worried about?
First off, Jennifer, why don't you say a little bit about what we do at the shelter here, and then maybe we can go into what the food and the different types of food that have come out in the last 5 years is just incredible.
You mean what do we feed here at the shelter? So we feed kind of a basic food from Purina because they give us a shelter discount.
Right.
And so it's kind of their general run-of-the-mill, decent quality food is what we feed a majority of the animals here.
And they seem to be doing fine on it, right?
Most animals do well on it. You know, diets, that's probably why it's such a common question, is the same in people. I mean, you think about how many people are out there proponing, yes, is that a word? I don't think that's a word.
That are proponents of?
It's something about a pony, right?
I don't know.
No.
Suggesting?
Yes.
Different types of diets. Yes.
Pushing.
And it's the same in the animal world. There are just so many different types of diets, and most animals will do fine on just a very basic kind of average price, average diet. There are some animals that have sensitivities or allergies to certain things, and they may need to be on special diets. Or some animals that have really sensitive GI tracts that need to be on kind of a bland diet. But you probably hear about the people who are 100 years old and their diets are not necessarily always these super quality. Sometimes they're the people who smoke, a pack a day and eat McDonald's every day. Just diet alone is not always the only thing that determines the health of an animal.
It is really interesting that people, over the holiday season, I would see these, Christmas feasts for dogs. Mm-hmm. It's like pumpkins. Pumpkin's always good for dogs, I think, because it helps their stomach, but not a constant diet of that. But anyway, can you touch on that?
I think the important thing is, just like us, we shouldn't just always eat kind of the same foods and then all of a sudden gorge on something totally different and expect to feel fine. Dogs shouldn't eat something they're not used to, large amounts of it, or they may have diarrhea or vomit or feel sick for a day.
Or they have that reaction right away. Yeah. So, and what about, I know we're still talking about diets and food. What about the dogs my dogs, for example, they love to eat grass. And I try to get fresh grass for them, the wheatgrass and stuff, so they can eat it. Is that a good thing or a bad thing? And why do they do that?
I wish I knew.
My dogs are in particular, but all dogs love to chew on grass.
All dogs love to chew on grass. It is not known. There's really? A lot of theories about it. There's no known reason. It's not that they're missing something in their diet. It's animals across all sorts of different diets, or dogs that are eating all sorts of different diets. So it's not that they're missing something. I think they physically like the
texture.
The feel of doing that.
Like I don't know.
We chew gum,
capers.
Or something, and we just.
I was thinking of
capers.
capers.
Do you like capers?
I love capers.
Oh God.
And I know that Rob has a lot of questions, but I just the diet.
You've hammered down 3 of them.
The diet is so interesting, and a few years ago there was this big kick about yes, dogs don't need to have animal protein diets. You can actually dogs can sustain themselves on a vegan diet. Is that really possible?
It's not recommended by the veterinary community, I'll tell you that. And dogs and cats are quite different in their dietary needs. So cats, for sure, they're obligate carnivores. They really do need
They need that
protein.
animal protein, yes.
Now, dogs are more capable of handling different types of proteins, but I think you will not find many veterinarians that will propose. Why am I obsessed with this word?
It's okay.
Proponent.
No, but there's got to be a verb form of that word. She has a good point.
Anyway, it's a good one.
I don't think you'll have see very many veterinarians that are suggesting a vegan diet for their canine patients.
I know it's just because on the vegan community, they find it weird that they are so careful about what they eat, and then here they are cracking bones and.
I find that really funny too.
It's not funny, but
I find it.
As
funny.
a vegetarian, I'm okay with it, because I know it's not me that's eating it, but I am supporting the animal industry that maybe I don't want to support. But anyway, I know they're happier with the bone.
Yeah, and it's obviously that they cannot survive on a meat-free diet as humans can, obviously, and we're learning more and more, and I'm not vegetarian or vegan, that's a pretty healthy diet, probably healthier than eating meat, using animal protein, or consuming plant protein instead of animal protein to suit those dietary needs. So again, going off of this,
But you're also going to talk about grain-free versus
right,
grain.
Yeah.
Now that is an important part of any animal's diet, because a lot of the food or the dog food that you can buy, you have to look. Really, it's important to look at what kind of grains are in there. Like there's a lot of fillers, right?
Yeah. Well, same as in humans. There are different buzzwords that come around, and right now grain-free seems to be this big buzzy kind of thing that people are talking about. There's nothing inherent about dogs and cats that they can't eat grains. Most dogs and cats can eat wheat and corn, the kind of normal grains that are rice that are in our kind of average foods. There are some that have allergies or sensitivities to it, and they may need to be on a grain-free diet. And a grain-free diet does not necessarily signify a better food. You could have crappy proteins and crappy carbohydrates that are not grains, and it would be called grain-free, and that doesn't make it a great diet.
That's a good point.
In general, it seems like more of the better brands have gone grain-free and are advertising themselves as such. And if you look at the proteins that are in there, they seem to be a better quality protein. So sometimes those go together, but it's not inherent that a grain-free diet is better than a non-grain-free diet.
What would you consider a bad protein?
A bad protein.
Well, you're saying there's some bad proteins and good proteins, like chicken and turkey and.
Well, yeah. I mean, chicken, turkey, beef are all fine for most animals that don't have a sensitivity to it. And even byproducts, people sometimes see that on an ingredient list and think that that's terrible. But in reality, sometimes byproducts are organs, which is actually great for
stuff,
So it's actually very difficult to say, oh, this one food is perfect and this one's terrible, and this one food would be great for all animals. It's what works for your animal, what they like to eat, what they maintain a healthy weight and a healthy coat on. If they're doing well and they have good energy and they have bright eyes,
don't change it.
Then don't buy into these fads.
That's a good point.
And I think what we should all be worried about, because there have been multiple cases of this over the past few years, is the content of the food, obviously if there's sensitivities, but numerous cases of tainted food coming out of usually imported food, where there are recalls, but those recalls only happen after, unfortunately, pets die. So, I don't know how, as a consumer, we can be more aware of that prior to recalls or prior to
watching those alerts, I guess.
Yeah.
Seeing how your dogs react.
Precisely. Yeah. So in this same vein, kind of on the same general topic, is pet obesity, which is really interesting, and you gained some fame for. Wow, we're having trouble with
gained some fame, but not weight.
Yes, thank you. Thank you for clarifying that, Ben.
And was on Good Morning America or one of the morning shows?
Today.
Can we not? Oh, sorry.
We can, but I'd rather not talk about meow.
Yeah.
So the point being that pet obesity is a big issue in the country and around the world, of course, and is a strange issue because unlike humans who may suffer from any sort of eating issue, whether it be obesity or any other, have obviously self-control issues that contribute to that. In the case of pets, we are completely in control of what they consume in terms of food.
Not unless they jump on your counter and eat everything they want.
Unless they're thieves, we are completely in control of what they eat. And so pet obesity is interesting because it's obviously creates medical problems, right?
Absolutely.
But it's a psychological problem of the pet owner or guardian that manifests itself in health problems for the pet. So how prevalent is this as you've seen it? And, seems like an obvious solution of how to resolve it, but do you have any recommendations in that regard?
Well, pet obesity is actually one of the leading causes of illness in pets in the developed nations. It has been growing as quickly as obesity in humans.
Really?
And we see all the same similar types of disease problems related to it. Diabetes. Diabetes used to not exist really
Yeah, I'm
in
just
cats and dogs.
stunned when you say
Yeah,
that.
and diabetes is very common now. Arthritis associated with carrying the extra weight. They've even shown, just like they have in humans, a link between obesity and certain cancer rates. It is a real problem, and a lot of people think of this, oh, it's cute, like a little, he's a
Chubby
little round
dog, yeah.
and little fat cat, but it really is a health
Can be a
risk for those
problem.
animals.
I know, folks. It's fascinating, and I've recently started calling out people that I know well enough that I feel like I can call them out for things about this, saying, "Hey, look, your pet's unhealthy." And
I always think it's a bad idea to tell anybody that their dog or cat is fat. I know that you could do it in a subtle way. I'm sure you do, Rob. But people are so sensitive.
I'm not subtle about
people
it.
are very sensitive. Don't you think that?
Well, they are really sensitive.
Not just sensitive, in denial.
Yeah, in denial for sure.
Yeah.
And that's, when people come in and see their veterinarian, and the veterinarian says, hey, your animal's overweight, a lot of people are like, they don't take it very seriously.
They don't.
And they really should. It'd be no different than if you said, hey, your dog's liver enzymes are elevated and this is a real problem, or, we've got a vision problem. These eyes are, going to have a problem in the future if we don't change something. It's as much of an indicator of future problems as any other thing. But it's something we can control so easily.
But I think we should also say that sometimes the weight gain may be caused by some other thing.
Yes. Not necessarily in cats. That's very, very rare in cats. In dogs, hypothyroidism is a fairly common problem in middle-aged to older dogs. And so if you have a dog that has always been eating the same amount and all of a sudden is gaining weight and seeming lethargic, then absolutely its thyroid should be tested.
Yeah, and in my particular case, Jimmy, one of my big dogs, he has slowly gained weight over the years, and I've cut his food down drastically. And then a month ago, got some tests, and he does have hyperthyroidism, and he's already lost 10 pounds since he's been on the pills.
It's very treatable if that condition exists, so dogs should be tested for it. Dogs should have routine blood work if they're middle-aged to older.
And is there any way to mitigate hypothyroidism? Is there something that might cause that at a younger age, exposure to anything? It's autoimmune, right?
Kind of. There's not any known factors.
Okay.
There's no studies to support any known factors.
But you said it is highly treatable.
Yeah,
it's manageable.
He seems to be so much happier now that I know that because, anytime you have extra weight, you are sluggish or you don't do as many things as you want to do, and you're not as happy. So now he's a lot happier, which is not exactly what I want, but it's okay. No, happy dogs are fun dogs. The only reason I say he's happy is because so now I need to play with him more.
Well, and hypothyroidism causes lethargy, and it also over time can cause sometimes a heart disease. So treating it really does make them feel better, not even just the weight gain part or weight loss part.
Why do dogs eat poop?
Is
that also unknown?
So I love. There's actually a word for that.
Coprophagia.
Yeah, I love that, the way it sounds.
Coprophagia?
Yeah, I don't know why.
Say it a few times?
No, I want to name my firstborn after it. No, I don't. I think it should be a great last name.
It's kind of a smooth Latin word if you don't know what it means.
Yeah.
We should all say it together.
It sounds like I'm actually almost. I can almost guarantee that that's a band name.
Oh,
it will be. It will be now.
Yeah. Black metal band name.
There again is not any real known cause for that.
Mhm.
Although one behavior cause is attention getting.
Really?
And so.
Well, yeah, if you like tell your dog, hey, stop that, and they're going
Yeah.
like, oh, you're paying attention to me.
Yes.
Oh.
And so that is something that's really important to try and resist doing. So some dogs learn that every time they go and sniff and start chewing on poop, that the owner gets very excited and, agitated and talks to them and gives them attention, and then they do it as an attention-getting
Interesting.
thing.
But I don't, not all dogs eat their own feces, but or anyway, there's just a few dogs that tend to be very curious about it, and there are different ways that I've heard to treat that, but I don't know if they're successful, like putting garlic powder or something in there.
No, don't ever put garlic powder.
Not garlic powder.
But there are certain things
Something like that.
There are things that
MSG.
you can feed them. Strychnine. There are things that you
Sorry.
can.
No, we're just joking.
Kidding.
Yeah, that might.
There are things you can put in the food that make the stool taste terrible to dogs, and there are over-the-counter products that are made specifically
that's probably
for
better
that.
than people rooting around
Is
in
it-
their spice cabinet.
Yeah.
So the dogs I've ever had don't eat their own. This is a much longer topic of conversation than we intended, but don't eat their own. But horse.
Oh,
manure,
well,
for
yeah.
whatever reason.
Everybody loves horse poop, right?
I mean, that's just like
got that
eating
sweet
grass.
smell.
That's
It's like-
fermented grass.
Yeah,
Why
it's
wouldn't they?
But so the question then of poop of any species, is it a health concern? Obviously, if they're eating it all the time, three meals a day, it's going to present health problems. But if it's occasional, as it is with most dogs, do we have to worry?
Not. I mean, for disgusting factor, yes. For medical, usually not.
Here's the thing: what I suggest: clean up the dog poop, clean up the horse poop. Just
Yeah.
make a habit of hygiene, and you won't have that problem really, because there won't be any poop to eat.
There we go.
Sorry.
Full safe plan from
Yeah.
Ben Swan.
We have
Just
we
clean up
have
the poop.
dog poop patrol almost every day at our house. 5 dogs. There's a lot of poop. So
How often? So this is interesting. I was reading about how often. So dental is one of the more common procedures, and when we say dental, it's mainly just a dental cleaning or removal of an abscess, or abscess tooth, if that's has happened.
So
Freestyle dental?
when you're talking about a veterinary dental cleaning,
Right.
that is usually the same thing as a dental prophylactic for us
Okay.
when we go get our teeth cleaned. So using an ultrasonic scaler and cleaning all the tartar buildup around the tooth. Now sometimes there are teeth that are loose or infected or abscessed, like I said, and that's like then goes into oral surgery and
Okay.
removing teeth or
because that can be a very serious issue.
absolutely.
A tooth decay can be fatal, right?
Absolutely. You can really, infected teeth can allow bacteria to get into the bloodstream through the gums, and that can cause heart disease, just septicemia, just all sorts of problems. I mean, obviously, you're not supposed to have bacteria just running through your bloodstream.
No, you're not.
So it is a cause of death, as well as just pain. There are a lot of older animals that end up with these loose, painful teeth, can't eat well.
They're crabby dogs.
Yeah, they're crabby and they lose weight and they can't thrive.
So, have you seen an increase in? I mean, now it seems like everybody gets their dogs and cats' teeth cleaned. Is that just because of the nature of owning pet population now, or old aging pet population, or is it just people are more aware of it?
I think people are more aware. Veterinarians are recommending it more. We understand how much more important dental care is. Animals are living longer, so they're needing that type of procedure more. I think it's a combination of all of those things.
So when homeless animals come into our shelter, we routinely give them examination, and part of that is the dental, always looking at their teeth, not only just to see how old they are, but how healthy they are.
Yes.
And so we routinely do some dentals on our shelter dogs here as well.
Yeah, if they have tartar buildup or loose teeth, we'll take care of that before they go to adoption.
Very good.
Is there any substitute for brushing? Some dogs hate brushing.
Yes.
And that dog paste dog toothpaste that they sell, I don't know.
Some dogs love that.
Some
stuff.
dogs like it.
The chicken
liver
stuff.
flavor.
Yeah, exactly.
Yeah. There are additives that you can put in the water that help diminish bacteria in the mouth and tartar buildup. Some veterinary dentists really recommend those. There are treats that are specifically designed to help control tartar, and I'm not talking about your pepperonis, like your actual actual dental treats.
Yeah.
Those are
greeny
helpful.
things.
Greenies are okay for most dogs.
Yeah.
But yeah, there are lots of things on the market. What you're looking for is something that's actually specifically says for tartar control, or recommended by a veterinary dentist.
I think you did one of my dog's teeth when she came in, and it was interesting because you said, see, this discoloration is not caused by any dental issues. It was because of some lack of her diet when she was a puppy or something like that, which is really interesting. I never really thought about that. I mean, really, the first 6 months of an animal's life is so critical in a lot of different ways.
And in utero. I actually have a dog that has enamel hypoplasia, which is something that happens when they're born to a mom that was either had a fever or a type of infection when she was pregnant, and so the puppies come out, and as they develop the teeth, they can have problems. So it's important all the way from mom through puppyhood.
That's very good. Good point.
And what about feline dental health? I mean, trying to get into a cat's mouth is infinitely more dangerous.
It's called anesthesia.
Do veterinarians recommend trying to brush a cat's teeth? How do we make sure they have good dental health? They're obviously more inclined to groom themselves, but in terms of, I don't know how you groom inside one's own mouth as a cat.
I have not known any to floss on their own or anything like that, but
I know
they would if they could. They're very tidy.
There's a YouTube video about cat flossing.
Probably just doing it to spite me.
There's just a lot of it.
I actually don't think it's that hard to brush most cats' teeth.
Really?
I used to brush mine and then I got lazy. But you're really looking at the outside surface. They have fewer teeth than dogs, and once you learn how to do it, it's generally not that hard. But there are treats. There are the same water additives for cats. I mean, there are all the same kind of products for cats. And dental health is just as important in cats as it is in dogs. Okay, good to know. Yeah, we tend to think of cats as more self-sufficient in a lot of ways, but
but they're not really. They just ignore you, and that's why we think they're self-sufficient.
And so. And this, again, is a question that applies to both cats and dogs. Obviously, I can't speak for you. Seems to me one of the bigger challenges of veterinary care is obviously the fact that your patients cannot explain what's wrong with them. What symptoms should we look for? And obviously symptoms are going to be different for different illnesses, but what sort of things should we look for to notice that there is something? What are common symptoms that we should look out for any variety of ailments? I think cats are really good at hiding their illnesses, and so you have to be more sensitive to small changes in them. Cats often will just hide when they're not feeling well. So if you normally have a cat that's out and around and you see it all the time, and all of a sudden you realize that it's hiding under the bed all the time, and it's not because your mother-in-law's visiting or something, then that could be an indicator that there's a problem. Litter box changes, they always use their litter box, and all of a sudden you're not seeing that. You're not seeing anything in the litter box, or you're finding urine or feces someplace else. That's a problem. Changes in weight and changes in their appetite. Those are all important. Dogs, same thing. If normally when you get up in the morning your dog jumps up and is wagging his tail and runs to the front door, and then they don't do that, any change in their behavior like that is a good indication that something's amiss. Okay. I saw an article this morning making the social media rounds claiming that bloat is the second killer of dogs in the world
very
after cancer. And I guess I didn't really know what was meant by that, but I guess they're talking specifically about gas trapped in the stomach and whether it seems like bloat was a sensationalized thing to focus on.
I never realized it was that prevalent.
I would be interested to see that.
See that article.
I don't. That is not my impression.
Struck me as yeah.
So bloat, when people say bloat, what they mean is gastric dilation volvulus, which is when gas gets stuck in the stomach and then the stomach turns, and so it creates a twist between the stomach and the small intestine, which then traps that gas in there, and it has no way of it. On the other end, it also blocks the esophagus. So you've got this now twisted, blocked
balloon kind of thing.
Yes, and the
explode.
gas continues to build up, and that twisting blocks the blood vessels to the area, so you'll start to get a dying off of that portion of the GI tract. So it is very serious. Dogs do die of it if it's not treated. They often need surgery, almost always need surgery to correct it. So it is a big deal. I would be very surprised to say that it's the second most common.
Right.
But And it's almost always large breed dogs, particularly giant breed dogs. Great Danes, probably one of the highest.
And big mastiffs, like just the one we just adopted.
This morning. He got adopted.
Mm-hmm.
Well, maybe we can start featuring, pictures or something overlaid of the animals we're talking about. But
definitely,
150-pound mastiff
Leo.
named Leonidas after the king of Sparta, I think, was adopted today. We were all very excited. Really sweet dog.
He's joining another mastiff at home, so they know what they're getting into.
It's a lot of dog.
Not a dog.
It's 300 pounds. Yeah, maybe. And then after we had a previous conversation in sort of a promo video, which I don't know will make it to air, but about obstructions in the GI tract, of usually foreign objects. So we get a lot of those in shelter dogs, right?
In shelter dogs, sometimes. Yeah. I mean, sometimes these animals have been out feeding on trash and what have you, trying to make a living out there on the streets.
We found some very interesting things in X-rays from shelter dogs, but not a lot. Just occasional kind of thing.
Corn
bags.
cob.
Oh yeah.
You remember that corn cob?
True,
Yeah.
Anyway. And those will almost, I mean, if an animal's being symptomatic of that, which usually is lethargy and refusal to eat, vomiting, that almost always requires pretty invasive surgery. Yeah.
If they're to the point that it's truly obstructed, yes.
And how successful are those surgeries? I mean,
It all depends on how quickly you catch it and whether the GI tract has become devitalized or not before you get in there. But even if it has become devitalized, you can sometimes just remove a section of the intestinal tract. So they have a decent chance, but sooner the better in prognosis.
Yeah, and some obstructions, like I think I remember at the Thaw Animal Hospital, a little pup came in with they had swallowed a marble, and it caused some obstruction, so they were able to fix that dog, which was great.
Rocks, marbles. I saw a cat that ate an entire rubber snake once.
Whoa.
A rubber snake?
A whole
Oh my gosh.
Yes.
My cat eats wood splinters, hasn't caused a problem yet. But
Oh yeah, you were worried about that last time, but
last time I was worried
it's
about
okay
that.
now?
Apparently, she hasn't changed at all. So
She's starting to carve wood now, right? And
She's just whittling wood.
Whittling wood.
She has no thumbs.
Yeah, it's like she has to use her teeth. Have you been looking at the things that she leaves for you? I'm sure they're beautiful little wooden something or others.
all around the apartment.
All around the apartment.
So I think the last question is one that I've had an issue with because of lack of personal organization, which is vaccinations. I lost my dog's vaccination records once. Didn't know how long ago he had been vaccinated. He also was probably vaccinated when first found at a veterinarian in Central America that I don't know how reputable he was. So if we're not sure of when our pet was last vaccinated and they need boosters or they need to be revaccinated, is there danger? How do we handle that situation? Is there danger to have them revaccinated at the full dose?
Well, that's a loaded question. But first of all, you can always call previous veterinary clinics and get copies of your records. So if you're like, I think it might have been, call around, try and find any records you can. They keep track of them for years and years. So you should be able to find it in most cases, unless maybe you're in Central America. Over-vaccination, that is not really a thing. So you can go on the internet and read about
all these kind of crazy things about, don't do that,
yes,
blah, blah, blah.
How vaccines have ruined the world for both people and animals. But I think sometimes we lose sight of why vaccines exist.
How important they are.
Vaccines exist because of truly terrible infectious diseases, and they were created to try and control those infectious diseases. So vaccines are not inherently evil. They are inherently good. They just need to be used in the appropriate way. And there's not such a thing as like, I got a vaccine this day, and if I get it, it's recommended that I get it a year from now, but if I get it in 6 months, now I've created a problem. All we know about vaccines that we've shown, or the vaccine companies have shown, that you have antibodies after that vaccine for up to a year. If you give it sooner, then you boost those antibodies a little bit more. It doesn't. You have to kind of understand how immunology works. So you will definitely find people who think that too many vaccines are the cause of
arthritis
everything,
and different
autoimmune
kinds of
disease.
things.
In the same way, in the human medicine field, there's the big movement about autism in children and childhood vaccines. Then you get that whole measles thing in California.
Totally discredited, by the way. The research shows it's not accurate.
Exactly, and there have been no studies that have shown definitively that vaccines
have caused any kind of autism or anything like that.
True, in people or autoimmune disease in animals. That has not been proven. There's a lot of speculation about it, but there really has not been any proof of that. So if you have an animal that you don't know its vaccine status and it's out there being potentially exposed to certain infectious diseases, I would always recommend that you vaccinate.
In our own particular case, some of the homeless animals that comes in, we don't know what their records are.
Absolutely.
We have to vaccinate them because we have a community to protect
Right.
of animals. And so anyway.
Right. And, you should be smart about it. You should know what you're vaccinating for and whether your animal has any, chance of being exposed to it. So I have 2 indoor cats. I don't vaccinate them for anything but rabies. At this point, they're not exposed to any of the upper respiratory infectious viruses at this point that are part of the combination vaccine, so I don't vaccinate them for that. I vaccinate them for rabies because rabies is required by law, and if some kid came to my house and pulled my cat's tail and it bit them, I would want my cat to be vaccinated for rabies. So
and that kid might get the cat rabies.
Well, probably the kid wouldn't get the cat
right.
rabies, but my cat might get thrown
Just joking.
So it's
and that's a very true case. And here in New Mexico, we've had outbreaks of rabies where they've gone into communities and have had to put down animals because the dogs and cats haven't been vaccinated for rabies.
It is something that it is such a pain in the rear if your animal ends up biting somebody and it is not current on rabies. Yes. You don't want that to happen.
Because then you just have to wait for them to become symptomatic of rabies?
Then your animal has to be quarantined.
For 10 days?
At least, and depending on the circumstances. Then the person has to go through it's just a pretty big headache for everyone involved. Mm-hmm. And really, do you want your animal to have to go someplace and be quarantined at a shelter? It's
away from the comforts of their home.
Yeah, really stressful, and
it's a terrible, terrible disease, and it's interesting. There's countries in the world that have eradicated rabies, apparently.
Hawaii.
What? Hawaii
is not a country, but
right.
Hawaii is a place.
And obviously because it's an enclosed system there.
Yeah.
But I think because of also probably I assume the large amount of wild animals that we have in the U.S. that
is true. Our rabies is kept around because of wild species. But also, if you look at some of the other countries that have rampant rabies in humans, it is still around and it is still a problem. I mean, there are a lot of people worldwide that die of rabies. So it's not some mystical disease that doesn't exist anymore. It does exist.
Mm-hmm. There's a famous Rudyard Kipling short story about rabies in India. Totally random point. Ben, do you have any other questions for Dr. Steketee?
Well, we talked a little bit before about the kinds of things that you see with animals, and it would be interesting to see if there's something in the homeless population that you see with homeless animal population that you see generally here at the shelter.
That's more common in the homeless animals than
nutrition.
Definitely we see a lot of dental disease, because many of these animals have not been very properly taken care of. So we do see more dental disease than you would even in private practice. And a lot of grooming issues, a lot of small breed dogs that have never been groomed, or at least haven't in a long while, and people think, that's cosmetic, but we get these animals that are so matted. We had one who almost lost her foot because the hair was so matted and had strangulated around the paw, and the paw was probably 2/3 of the way cut off just from the hair. So
luckily, we were able to help her out,
and she's doing great.
Yeah, she's doing great. She's in foster care now.
She is, and actually, I think she's in the process of being adopted right now. Awesome. But yeah, it can be serious. It's important to take care. If you have a long-haired dog, you really do need to take care of that hair. It can be medically important.
Good point.
That's all the questions I have. Unless you have a question for us.
Jennifer, I know that you are like a world traveler, and you work with animals when you go on some of your trips. Can you just touch briefly on that and what you see differently in different countries?
Well, I did do a little spay-neuter in Madagascar a few years ago, and that's an area that has rampant rabies. And they really have to control their canine population because of fear of rabies. In fact, I was involved in a project on the Fusa, which is this endangered species there, and they were very worried about the dogs in the area spreading rabies to this endangered species. And so we were going through and doing some spay-neuter, but definitely vaccinating all the dogs. And just how important that can be. You think about some of these infectious diseases, and we live in a
relatively safe
area,
yeah.
but they can be very serious if they get into a pocket of an area and we have an unvaccinated population.
So another reason to vaccinate your animals and yourself.
Right.
Especially if you're in Madagascar.
Yeah.
Particularly if in Madagascar.
This is a small predator, right? Kind of canine.
It's their
type
largest predator. It's a very strange little creature. It's kind of like a mix between a cat, a dog, and a weasel.
Wow. We'll have to throw a photo of that up. So
Yeah,
we can-
right.
Yeah.
Yeah. That's gonna.
They're amazing looking.
But if you're only listening to the audio, you're
It'd be nice to
deprived
talk.
of that.
We'll have to look at different kinds of how people treat their animals in different countries. Would be something that we could do
Culturally would
future
be-
podcast, and also from your perspective as a medical.
Sensitive, yeah, but fascinating, absolutely fascinating topic about the roles, I guess, culturally that animals play in the home or society.
Even from my home state, Alaska, a lot of people think that the huskies, the mushers those dogs have a terrible life, and some do, I'm sure, and some are just quite happy to mush along.
And in New Mexico, we have a different. I'm from the Northeast originally. Different, even in the United States, a lot more dogs spend their entire lives outside here than they do in other parts of the country, and I can't say whether that's objectively good or bad. Seems like that's the way it was.
It depends on if the dog really likes it.
Exactly, and if they have
Some
a
dogs like to be
physiology
outside.
that's suited for the climate as well.
That's true.
So, unless anybody else has anything else,
Thank you, Jennifer. I really appreciate you coming on.
Yes, thank you so
Anytime.
much.
Exploring all these issues, especially the whole fecal matter.
Yeah, we spent a lot of time on feces.
Which I'm going to talk
Today's
to Rob's
episode.
counselor about as well. 'Cause I thought,
I don't have a counselor. Why is it my problem?
Well,
I don't eat feces. My dog doesn't eat feces. I was just asking. I know it's a common issue. People had questions about
he's so
it.
defensive. He's defensive.
Yeah, I see that.
Just saying. It's,
Classic.
okay.
Classic.
Well, now that we're
That
done
we
making fun of
destroyed him.
me,
Yeah.
thank you so much for coming on, and I'm sure we'll have you on again. And this has been this week's episode of High Desert Podcast. Thank you all so much for joining us again.
Do we have a theme song yet? No.
We do. We
'Cause I
do.
was thinking we could just start barking or something at the end. Like when you can say High Desert Podcast, I'll go ruff, ruff. No, maybe not.
To correct me?
Yeah. No. Anyway. Pause that.
we do, and it'll be on this episode. So so you'll hear it, and we have a logo and everything. We're really official.
There we go.
Yeah. So thank you so much for joining us. And if you have any questions, as always, you can send them to us at podcast at sfhumanesociety.org. That is PAWEDCAST at sfhumane with an E on the end society.org.
.org. Thank you,
So
Jennifer.
thank you all so much, and thank you, Dr. Steketee, and everybody have a good week.